AZCCC presents the Cancer Care Podcast, Arizona Center for Cancer Care. Comprehensive care with the highest quality of cancer treatment in Arizona. Joining us today from the Virginia G. Piper Cancer Care Network, AZCCC medical oncologist, Dr. Stephanie Lindauer. Dr. Lindauer's guest today is also from the Virginia G. Piper Cancer Care Network at HonorHealth, nutritional dietitian Terri Taylor.
Yeah, so AZCCC and Virginia G. Piper Cancer Care Network medical oncologist Dr. Stephanie Lindauer, and we'll also be bringing in her special guest. But let's start with you, Dr. Lindauer. How are you?
I'm good, thanks. How are you?
I'm great, and we should tell everybody, because I'm so proud, that you were a doctor for my family with my mother-in-law.
Yeah.
So we had the super team of you as medical oncologist and Dr. Stephen Skolnick as our radiation doctor. And we were just very blessed. And now I can actually give you a testimonial that you're the best.
Well, it was an honor. Thank you.
Well, thank you. So we're going to introduce your special guest here in just a few minutes. So many people are familiar with you because you've been generous before to give us your time. But still, there's new people moving into Arizona all the time, and some people aren't familiar with you. So let's kind of start there. A medical oncologist, just kind of break that out in general, what a medical oncologist does.
Sure. So my role as a medical oncologist, I treat all types of cancers, and I work in conjunction with oftentimes other surgeons or radiation oncologists who we work as a team for many different types of cancers. So my role as a medical oncologist, I call myself kind of the medicine person. So if somebody needs chemotherapy, if somebody needs medicines, and then also to kind of coordinate care between the different specialists, that's how we approach cancer depending on what type of cancer that patient has. And then oftentimes follow those patients out for many, many years, hopefully, after their initial diagnosis and treatment to make sure that they're remaining healthy and doing well.
So after diagnosis, is it fair to say that a medical oncologist is pretty much the quarterback deciding on the treatment options and what's best for the patient depending on the diagnosis?
Depending on the diagnosis, yeah. We work as a team, but oftentimes we're kind of the quarterbacks and coordinating their care.
And once you decide on the treatment options and which direction a patient should go, do you stay with them on the journey, or is that the point that you hand it off to the specialists?
Oh, absolutely. We're there throughout the whole journey and hopefully for many, many years after their initial diagnosis and treatment.
Why oncology for you? Let's go back to little Stephanie Lindauer before you were Dr. Stephanie Lindauer. Why?
I think it comes from growing up, my mother had breast cancer. And so being on that side of things and seeing how important the oncologist's role is not only to the patient but their family, and what a strong relationship that is formed there really impacted me. And then when I decided I wanted to go into medicine, doing my rotations and experiencing different areas in medicine, the one thing that continually drew me to this area was the ability to maintain a relationship with the patient and family long term. So I really enjoy that. I like getting to know my patients, having a long-term relationship with them, and being able to have the honor of taking care of them through their cancer journey. So that's very different from other types of specialties. My husband is an anesthesiologist, so it's completely opposite. He says hi to them and then puts them to sleep and then says goodbye.
Whoa. Puts them to sleep in a good way.
In a good way.
We're talking.
For surgery, yeah.
They're going to wake up.
Oh, yeah. They always wake up.
I'm just curious. This almost sounds like a setup, for a monologue. You have a medical oncologist married to an anesthesiologist. What do you talk about at dinner? Do you talk medicine or do you talk the sons?
We try not to talk medicine, but it's also helpful to have somebody that just kind of understands things. So,
I've noticed that with a lot of doctors with AZCCC that I've been blessed enough to get to know. When I ask about the why, it usually comes from a personal type experience like you and your mother who went through breast cancer. And it can come from a good experience or a bad experience. For example, when we had Dr. Dietician in, she mentioned that her why was through a bad experience because she was from a community that really didn't have the best in cancer care. So she wanted to learn to provide that. Was your experience on the good side with your mother's care or on the not so good side?
Yeah, absolutely on the good side.
Good.
And so that was the inspiring thing, and that's really what made me want to be that person and be able to provide that care.
I remember talking to you before, and I've always been curious about this, so I just have to ask. One of your specialties is listed as cancer survivorship. Now, in my opinion, everybody's specialty is cancer survivorship. What exactly does that mean?
Well, I think it's just the recognition that even after cancer treatment, a lot of patients continue to have symptoms from the treatment that they undergo that impacts them physically and emotionally. And so paying attention to that and recognizing that, and that kind of leads into our discussion today about nutrition and the importance of keeping the body healthy and focusing on nutritional aspects as a survivor. That's kind of what that focus is just recognizing that there are unique issues that survivors face after cancer treatment and that we need to be aware of them and able to help those people through that time as well.
And once again, just drawing from personal experience with my mother-in-law, who, again, you treated, she was diagnosed late, stage 4, but it was all about quality of life.
Yeah, absolutely.
And she absolutely lived and had a wonderful last portion of her life because she was feeling better. And you brought her mental state back around, and I'll forever be thankful. When you talk about nutrition, that's a wonderful transition to your guest today. Why don't you make the introductions?
Yes, so this is Terri Taylor. She is our registered dietitian that works with us in clinic, and she has a very, very important role in patient care, so we're really happy to have her here.
Hello, Terri.
Hi, thanks for having me.
Well, welcome. I just have a feeling that you guys are already friends and very familiar with each other. Tell me about that, the relationship between a registered dietitian and a medical oncologist.
Yes, it's really, really important to have a supportive team working with our patients. And so Dr. Lindauer is one of those very, very proactive physicians who recognizes the importance of nutrition in terms of prevention and treatment and survivorship for her cancer patients. And so what we do is she will see her patients and she will refer them to me so that they can do individual nutritional counseling with me, and we can follow up beyond their treatment and keep them healthy after that.
So, Dr. Lindauer, when you send a patient to Terri, is that all patients, or is there a specific type of patient that you send for nutritional help?
It's really specific patients depending on the situation. So there are some patients that need help during chemotherapy, and the focus is focusing on nutrition while they're undergoing treatment. For others, it is after the treatment, and they're struggling with their weight or how to be healthy, and so the focus is on that survivorship issue. And then for others, it's maybe in their late stages of cancer, and they're struggling with weight loss and cachexia and decreased appetite. And so those are all very different things, but Terri helps with them all.
So Terri, kind of break this down for me. So let's just take two big treatment options, chemotherapy, radiation. Mm-hmm. And as Dr. Lindauer just mentioned, the loss of appetite, chemotherapy is pretty common. As a nutritionist, is it more of a supplement, or is it a way to get them back on a diet of eating more?
So it's very important to recognize that all treatments have many different side effects. And so since I am a board-certified specialist in oncology and nutrition, I work very closely with oncology patients that are receiving all kinds of different chemotherapy and radiation or concurrent treatment. So when we look at that, some patients will have loss of appetite. It may be for many different reasons. Maybe they have no taste for food. Maybe they're very tired. Maybe they have mouth sores and they can't eat. So it's my job to be kind of the detective to figure out where those things are coming from, and then to come up with a solution on how we're going to address that so that we can maintain their nutritional status. Very important, because when you look at nutritional status, that affects a lot of things in their life. Are they able to do things? Not eating, so they're losing weight, they don't have muscle mass, they aren't able to do the physical activity that they normally do, or engage in social things that they want to do. So we address nutrition as a way for them to maintain those very, very important things that are important to them in their life.
So, Terri, for you, you're really addressing the patient on a mental and physical side.
Correct. And that is one thing that really has drawn me and given me a passion for oncology nutrition, because it really draws on many, many clinical skills along with nutrition. A lot of times there are issues that are more psychological or environmental things. So we can work through all of those with food and nutrition. And I think you probably realize that food does have a mental connection for sure.
Absolutely.
And so sometimes when we're working with patients is trying to overcome that, or trying to come up with a plan that's workable for them and for them to be able to get some confidence with eating and know what to do. Because a lot of times when people don't know what to do, they struggle and then they aren't able to do anything. So again, if we can come up with a plan that works for them to address those issues so they know what to do and can be successful and get some confidence, it makes a big difference in their treatment, in the way that they handle their treatment, and hopefully in the outcome of their treatment as well.
And being able to eat properly is a big part of just happiness and being positive, right, Dr. Lindauer?
Yeah, definitely.
Yeah, because that's one of the things that you really instilled in us was just quality of life, quality of life. And I know it's tough, especially going through chemo. So been there, done that. I certainly remember. Radiation, is that pretty much the same challenges or a little bit different for you, Terri?
Yes, so it depends on where the radiation is being administered and the type of cancer. But again, if we're looking at radiation in the head and neck area, there are going to be a lot of issues with swallowing and eating and those types of things. So we need to come up with a plan of what's the best route of nutrition to provide for them. If it's a breast cancer patient, we might be looking at some skin changes, but we're really looking at residual side effects perhaps from chemotherapy, or again, the survivorship issues is how do we stay healthy after treatment and address other types of chronic diseases or reduce the risk of recurrence.
How do you guys handle, as a patient is going through treatment and their system changes, bad habits? I mean, patients that have been drinking or smoking their whole life or eating high-calorie foods. I'm just curious how you approach that conversation, because you're already talking to them, especially you, Dr. Lindauer, at such a sensitive time in their life, and now you're going to take away some of the vices that are not good for them that they enjoy most, or maybe you and Terri do that together. Kind of walk me through that.
Actually, a lot of people, when they embark on a treatment plan, are very motivated to try and do the healthy thing. The very common question we get is, what diet should I be following? What specific foods should I be eating to try and keep my body healthy during this? So oftentimes the patients are very goal-oriented and motivated to try and be healthy during the process. Things like smoking, tobacco use, alcohol use, we know that those things are definitely risk factors for not only for many different types of cancers, including in the head and neck region, the mouth, the liver, breast cancer, colorectal cancer. So obviously we try and counsel people to stop these things, especially during active treatment. Also after, to reduce their risk of any cancer recurrence. But I would say that most often people are pretty motivated to try and adhere to healthy diets and healthy behaviors, and really are just looking for guidance on how to do that. And so that's why having a registered dietitian is very helpful.
And so the patients are hungry for help,
Yeah.
literally. So when you mention after and cancer reoccurrence, that's an interesting topic, Dr. Lindauer. And Terri, when it comes to that, educating the patient seems to be just as important as treating the patient. Have you found that patients get into better habits after they're treated?
I agree with what Dr. Lindauer was saying, that unfortunately some people are motivated by fear to begin with, I would say, with the diagnosis, and they are very interested in making changes at that point, and they really are concerned about having a recurrence. And so that is a good time to start building on healthy habits, especially when we're talking about physical activity and eating. The thing is when we're doing that, sometimes if we do too much at one time, it's very overwhelming. So it's important to work with that patient and find out what their priorities are, and then to start working on those, and of course, incorporate incorporate the things that I know are important in terms of eating more fruits and vegetables and getting more fiber, maybe reducing some of the processed foods and doing some activity. All those kinds of things are things that we would work on. And again, establish goals and what works with their lifestyle, because we're not talking about Dave doing something for a few months and saying, oh, okay, this is good now. I have my first scan and everything's cool. It's like, no, it's like, what can we
I'm a
do?
guy.
What can we do?
I know.
To sustain those habits. And so that is one thing that's very important, that I do close follow-up with my patients, because we want to make sure that what we're talking about is working for them. How can we modify it? How can we go on from that to, again, make sure that they're able to sustain those things and incorporate it into their lifestyle and their family's lifestyle.
Terri, let's talk about the preventative side, which Dr. Lindauer also mentioned. When Dr. Lindauer has a patient that's diagnosed and then she sends the patient to you as a registered dietitian, that's one thing. But there's also patients that genetically have cancer in their family history, and there's an educational portion of this before they may ever even be diagnosed with cancer that could possibly help them. Do you get the chance to, number one, be able to identify who those people are and hopefully be able to educate them so that they have a more positive future?
Yes, that is, of course, the optimal time to be working on changes in eating to prevent cancers. We do at HonorHealth have some early detection programs where patients would be referred to me for nutritional counseling with certain parameters. Many of our primary care physicians are aware of things like obesity as being a major risk factor for developing 13 cancers or more. So that would be a conversation, again, that they would start perhaps with their primary care physician and then refer them for nutritional counseling to me so that we can work on that. Other things that we look at, again, what kinds of foods are they eating? What are they doing in terms of their activity? There are many times questions that come up about supplements. So there are really a lot of opportunities to reach out and start working that prevention part, because prevention is very, very important. And we know now through the research that primarily eating patterns that are high in plant foods, so fruits and vegetables and dried peas and beans and whole grains and nuts and seeds, a little bit lower in red and processed meat, processed sugars and processed fats and alcohol, are things that we know can make a difference in terms of prevention of cancer.
Are things typically good for a person like ice cream, hamburgers? Can you give me a little defense here when I talk to Mrs. Pratt? I talked to Terri and she said...
Important thing to remember, it's not all or nothing. And I think people get that idea that it's all or nothing. Yeah. And so there are ways to work those in, or maybe there are different choices to make in terms of ice cream and hamburgers and some of those things. So, of course, we could work that in for you.
You can't blame me for trying, okay? So, Terri, can I humbly tell you something behind the scenes? Okay. Knowing that you were going to be Dr. Lindauer's guest today, knowing I was going to do the interview, I thought, okay, Terri Taylor, let's go ahead and check into her and see what she does. So I have a little bit of background. And I talked to Lisa, one of the reps from AZCCC, who helped bring you in today. And I said, what's a registered dietitian? And I said, it's okay, Lisa, I'll take a look myself. And I started going online to figure out what a registered dietitian is. And then I became intimidated because I'm like, oh man, I'm going to have to suck in my gut for the entire interview. I'm going to have to tell her that I already have good habits. And that leads me to a question about the internet, because there's guys like me, that's the first place they go. And Dr. Lindauer, I want to ask you about this too, but Terri first. Is the internet and people being their own Google Docs, is that a help or a hinder to you?
There are certainly some reputable things that you can find on the internet, but there are a lot of things that are misinformation and myths as well. So it's very important to, again, look for websites where you feel that the sources are reputable, things like the American Institute for Cancer Research or the American Cancer Society or things like that, HonorHealth.
AZCCC, right.
Exactly.
Yeah, got it.
And sometimes it can make patients a little bit worried or obsessed when they're finding too many things or going on certain blogs where they're getting information that is incorrect and making them afraid to choose foods that they may not need to be afraid of. So I think it's important to give patients reputable resources that they can use to encourage them to see professionals like ourselves so that we can sort that out with them. We don't want to take away their thunder and say, don't go on the internet. Sometimes when patients are diagnosed, they get a little bit overwhelmed and they have to take a break from the internet because there is too much and it is too overwhelming. So I think there's a nice balance that you can use when using social media and using internet.
So, Dr. Lindauer, I can't even imagine your world when it comes to the internet. Again, drawing on personal experience, I remember getting the diagnosis at the hospital, almost being in a panic for my mother-in-law, and I'm on the internet trying to find everything. And finally, my wife, who was much smarter than me, she said, Dave, Jenny at AZCCC already connected you with Dr. Lindauer. Just wait. Why don't we talk to Dr. Lindauer first? Do you wish that was the case with most?
Yeah, certainly when you get this initial cancer diagnosis, there's a lot of anxiety and a lot of people deal with that by education or trying to educate themselves. But the problem is that online there's all kinds of misinformation. I think with regards to the nutritional aspect of things, a lot of people come in, they see these like fad diets online, want to implement these crazy and unrealistic type of diets. And so you just have to kind of teach them that it's not about fad diets, it's about being healthy, learning a way to be healthy that you can continue for the rest of your life and how to incorporate behaviors to do that. It's not about just doing keto diet all the time or something like that. It's not about just doing the latest thing. It's about really trying to understand behaviors, implement those healthy behaviors, learn how to shop healthily, look at labels, and then really, really importantly, incorporating physical activity. I think that's the big thing that a lot of people forget as they're looking online and they're trying to look at all the, what supplements should I take, what diet should I do. It's really important to balance that with regular physical activity, and that really makes a difference in lean muscle mass, preserving the right type of body weight that you want. A lot of people, particularly breast cancer patients, when they go through chemotherapy, majority of them actually gain weight after their treatment instead of lose weight. The data has shown that a lot of that weight is coming from adipose tissue and not lean muscle mass. And so trying to incorporate regular physical activity to preserve that muscle, that good weight, is important throughout the course of it. And so it's just a matter of kind of looking at that as a whole and trying to steer them away from the latest supplement that they're reading online.
Yeah, that's a challenge. Terry, how do you consult that during treatment? Because this patient's body is changing. They probably don't feel too good, as Dr. Lindauer said. They're in a panic state, and you're giving them nutrition, but you're also suggesting to stay physical and stay active. Wow. How do you address that with them? And are they really capable of being as physically active as they were before they started taking chemo or radiation?
Yes, it is achievable, so that's important to begin with. Also, we do know through research that doing physical activity does help to reduce the fatigue that may be a side effect from some of the treatments that they're receiving, which is kind of ironic because people would think, oh, if I'm tired, I shouldn't really do anything. But actually doing some physical activity helps to keep that energy level up throughout treatment. And sometimes people get the idea that it has to be, oh, I need to be on the treadmill for an hour or something like that. No, it's like, let's do 5 minutes or 10 minutes, maybe at a lower interval that you were doing before, and try and do that several times during the day to keep that energy level up. It's very important, as Dr. Lindauer was mentioning, about maintaining lean body mass. We know that maintaining lean body mass has been shown to perhaps give a better outcome from treatment. We know that in breast cancer survivors, if they have more lean body mass and less body fat, they are potentially producing fewer cancer-promoting hormones, things like estrogen and insulin-like growth factor, which again are issues for recurrence in other cancers. So it's not just looking at the weight on the scale, it's looking at the body composition, and that's something we would do in the office as well, is look at body composition. It's important for them to know that up front as well, that, wow, maintaining your muscle mass is going to hopefully make a big change or positive impact on how you do with treatment. So let's work on that to begin with. Let's use that as a goal. Again, we talked about strength and balance and those types of things, and so lean body mass helps support that. Bone mass, you need more muscle mass to maintain bone mass and those types of things. From a nutritional standpoint, along with the activity, is really important that they're doing a lot more protein. So that is a huge emphasis to maintain that lean body mass. And also some other types of foods, like foods that have omega-3 fat in them. You may have heard of fatty fish having omega-3 fat. So there are some nutritional things that we can work on along with the activity to maintain that lean body mass. Sometimes when patients come in and they are obese to begin with, they don't realize that they may be obese, but they have a low amount of lean body mass, and that is associated with the poorer outcomes. So again, we work on lean body mass a lot.
The fish thing you mentioned, that I can relate to. I like Swedish fish. Do you like those? Are those in there? Terri, I am so glad that this is an interview and not a lunch, because I would be so intimidated to order. I would be one of those guys like, I'll have what she's having, and then I'd have no idea what I'm eating probably. So, because you're probably the most disciplined person on the planet, right?
Oh, I wouldn't say that, but I think it's important to understand that dietitians are not food police, and dietitians are not judging what people are eating.
You're not going to slap my hand.
I'm not in the grocery store looking at everybody's cart or anything like that. We understand that there are things that we can include and not be worried about. So never be intimidated by a dietitian. Of course, I will tell you that I don't get invited to many barbecues. I don't get invited to many happy hours, because we know that more grilled food, maybe higher cancer risk, alcohol higher cancer risk. So, and of course, when I come, then the veggie trays come out compared to the chips. When I leave, those all come out. So.
I've never seen you in the drive-thru getting curly fries. I'm just throwing that out for you, okay? Do both of you find that sometimes people come in with their own diagnosis, like Dr. Lindauer, they'll go, yeah, so Dr. Lindauer, I was thinking I'm gonna do radiation. or Terri, they'll come into you and they'll go, no, I've decided I need to eat more sugar cane and bean sprouts. We'll just slow down there. And I think a lot of that comes from the internet, but do some patients come in kind of headstrong thinking that they know what's best for them?
Yeah. There's always some of those patients, and so you just kind of gently guide them back to the path they need to go on.
You're too polite to laugh. No, because you are a classy lady and you're too polite to laugh. That's why I couldn't be the doctor. I'd be like, are you kidding me? All right. Let's talk about June being National Survivors Month. I think the word survivor may have a different connotation with many people. So being a cancer survivor, does that mean living? Does that mean living with quality, as we discussed, Dr. Lindauer? Or can that be people who gallantly fought cancer and may not be with us today? Because in my opinion, they're survivors too, because they battled, and through medical oncologists like you, Dr. Lindauer, they were able to fight through and still live the last portion of their life with quality. What does Survivors Month mean to you guys?
I think that term, that definition is ever evolving, and especially now that our therapies are allowing people to live longer and longer with good quality of life, that term is encompassing a lot more than just the typical, what we used to think of as cancer survivors being, after X number of years not having cancer recurrence as being labeled as survivors. I think that now that's encompassing a lot more types of patients. So I think that's important and makes it ever more important that we recognize some of the unique issues that they face, and also to do our best to counsel them on how to maintain and live a healthy lifestyle so that they can remain survivors.
And Terri?
My understanding as well is when we talk about survivorship, it really starts at the time of diagnosis. So you can be a cancer survivor when you're first diagnosed and going through treatment. So I think before, people thought, again, it was, after I'm done with treatment and whatever time period, then I'm a survivor, and that's not the case. It's an ongoing journey to be a survivor. And when we look at survivorship, it's very important to realize now we do have many treatments that are so effective that they are going to be cancer-free perhaps at the end of their treatment, but they may have lingering side effects from their treatment. Some things like that might be, again, a breast cancer survivor may have loss of bone mass, or what we call osteopenia or osteoporosis. They might have some nerve ending damage called peripheral neuropathy after completion of treatment.
Is that the same type of like neuropathy in feet or something like
Correct.
that makes, or fingers cold? And
that's a very common issue with a lot of our chemotherapy agents, is the nerve damage, or otherwise known as neuropathy. And typically these things improve over time and get better, and for a lot of people go away, but for some people it stays. And so that's definitely a survivorship issue.
So, Terri, for patients that come see you or clients that don't have cancer, but they have something like neuropathy, although you specialize in oncology, you can obviously help them too, right?
Yes, absolutely, of course. And so when we have patients that we see up front before they start their treatment and we know that there's a huge possibility that they could get neuropathy from the treatment plan that they're on, we try and be very proactive. And so we give them some nutritional supplement ideas that may help to reduce the risk of getting the neuropathy, doing some things like using cold mitts or cold socks and things like that during their treatment. Again, really encouraging them to be doing some activity. We do have some occupational therapists that work specifically with chemotherapy-induced peripheral neuropathy at HonorHealth that give them exercises to do to reduce the risk of that coming or to try and manage that. Dr. Lindauer will be very closely monitoring that as well and seeing if there needs to be a treatment reduction to try and deal with that issue. But again, those are all things that I think people don't understand, that there are some things that we still need to address after treatment, but they are very well managed and controlled. So through changes in activity, supplements, diet, other types of disciplines being involved.
So here's what's going to happen. People are going to hear this interview, and because both of you have shared so much, they're going to go, I got my team now. I have Dr. Lindauer and I have Terri Taylor. Are most of your clients through referrals, or people can contact you direct? Typically, should they go to their primary first, Dr. Lindauer, and then they'll recommend, or?
Yeah, usually we see patients by referral from either a primary care doctor or maybe a specialist like a surgeon or a radiation doctor. But we see patients in clinic and they can either go by way through a primary care doctor, or we have our patient phone number, new patient referral line that anybody can call.
Okay. And it's ArizonaCCC.com, ArizonaCCC.com, and that's where you can find information about Dr. Lindauer and more. Terri, what about you? How do listeners schedule with you?
We do ask that they get a physician's referral for nutritional counseling as well. And it can come from any physician that can refer for nutritional counseling. That goes through our centrally scheduling department at HonorHealth, and then they schedule their appointment. It can be anyone in the community. So we aren't limited to just our system as well.
Have we missed anything, ladies? We've covered a lot. Okay, quickly, just for fun. What do you do for fun, Terri? Come on. Music, sports, entertainment, getting out hiking. I don't know. What do you do?
I'm a very passionate lap swimmer.
Freestyle, backstroke.
Freestyle
Okay.
for hours and hours a day.
Okay.
I love it.
You have a home pool?
Where I live, there's a pool. It used to be a YMCA, so there is a huge pool there.
You know what I tried, Terri? I tried one of those little lap machines. Have you seen them? They look like a box. I don't know if I was going too fast or too slow, but it's like the guy that can't do a treadmill. I'm like, no, it just isn't. I need a pool.
I was wondering what those were like, so I'm glad to hear your take on it.
Okay, no, I'm impressed that you're getting out there, and this is the weather to do it, too. All right, Dr. Lindauer, what do you do for fun? Your golden lab. Do you still have your golden lab?
Yeah, so I love my dogs. I have pictures of my dogs in my exam rooms, actually. So
I remember you had a puppy.
Yeah, so I have a golden retriever named Leo, and I have a chocolate lab named Kona. So those are my fur babies. So I love spending time with them, being active, and traveling with my husband.
All right. I want to say West Virginia, if I remember. Is that right?
Medical school, West Virginia. Yep.
And then Texas.
Mm-hmm. My residency and fellowship in Texas.
Okay. And your husband?
We met in medical school, and then we did our residency training in Texas together.
I have one favor to ask you ladies as we wrap up. Terri, would you try to come up with a non-kale diet, something that has no kale in it at all? Kale is my kryptonite. Kale is my enemy. I went to a restaurant and they served me a Caesar salad with kale. Come on. No, Terri, I want a bowl of croutons with just a little tiny bit of lettuce.
There's always room for that, and keto is not the answer for everyone. So,
all right. Registered dietitian Terri Taylor with HonorHealth. Terri's also with the Virginia G. Piper Cancer Care Network. And, of course, Dr. Stephanie Lindauer, medical oncologist with Arizona Center for Cancer Care and the Virginia G. Piper Cancer Care Network.
Thanks for listening, and please join us again for the Cancer Care Podcast, presented by Arizona Center for Cancer Care. For more information on the highest quality of cancer treatment in Arizona, please go to ArizonaCCC.com.